So the two surfaces are anterior superior surfaces and posterior inferior surfaces. This is the part two of the external features of the stomach. Then the stomach is divided into two parts, cardiac and pyloric. There is a line joining from the left, and the cardiac angular notch plays an important role in the pyloric canal. Then we have the cardiac part. The fundus of the stomach is the upper convex dome shaped structure which has the horizontal line drawn at the level of the cardiac orifice seen clearly in the radiographic examinations. Then the body of the stomach, we need to write the mucus cells, the chief cell, peptic cells, zymogenic cells, parietal cells, oxyntic cells, which secrete HCl, and the digestive enzymes. Pyloric part antrum contains the uh, sulcus and terminates from the pyloric canal. Now, the relations of the stomach we have is the stomach is lined by the peritoneum on the both of its surfaces, so it's not an retroperitoneal. Kidney, duodenum, etc. are retroperitoneal. At the lesser curvature, the layers of the peritoneum lining the anterior and posterior surfaces meet and become continuous with the lesser omentum. Along the greater part of the greater curvature, the two layers meet to form the greater omentum. Near the fundus, the two layers meet to form a gastrosplenic ligament. Near the cardiac end, the peritoneum has a posterior surface related to the stomach in direct contact with the bare area of the stomach. The visceral relations are the diaphragm, which separates the stomach from the left pleura, the pericardium, and the sixth to ninth ribs. The costal cartilages are separated by the from the stomach by the transverse abdominis. Then we have the trobe space, which is the space between the left costal margin and the lower edge of the left lung on the stomach. Then we have the percussion resonant note. Then the posterior surfaces is the stomach bed. Stomach bed, at least if you don't write the anterior and relation, if you write the stomach bed, you will get marks. So it is diaphragm, left kidney, left suprarenal gland, pancreas, transverse mesocolon, splenic flexure of colon, splenic artery. Sometimes the spleen is also included in the stomach bed. So stomach beds diagram I need to show you. This is the stomach bed diagram, which you need to know how it has supposed to be drawn. So if you draw it two or one time before the exam, you may get to know it. As I did a mistake, I learned to draw it before, but I failed to revise in before the exam, so I made a mistake in that. I recommend you to like draw this before at least a day of the exam. So this is the area related to the diaphragm. Then we have the spleen. We have the splenic artery. Then we have the splenic flexure colon, transverse colon. Then we have the transverse mesocolon. Then we have the pancreas. Then we have the celiac trunk. Then we have the left kidney, left suprarenal gland. The stomach bed is the posterior relations of the stomach. Then we move towards the blood supply of the stomach, which is supplied across the lesser curvature by the left gastric artery, a branch of celiac trunk, right gastric artery, a branch of proper hepatic artery. So, gastric artery is a branch of celiac trunk, and gastric left gastric artery is a branch of celiac trunk, and right gastric artery is a branch of proper hepatic artery. Then the greater curvature is supplied at the right epiploic gastroepiploic artery, which is a branch of gastroduodenal, and left gastroepiploic artery, which is a branch of splenic artery. Fundus is supplied by 5 to 7 short gastric arteries, which are also the branches of splenic artery. The veins of the stomach drain into the portal, superior mesenteric, and the splenic veins. The right and the left veins drain into the portal vein. Right gastroepiploic vein ended to the superior mesenteric vein, while gastroepiploic and short gastric veins terminate in the splenic vein. The stomach can be divided into four lymphatic territories. The drainage of these areas are left one third is into the pancreato-splenic nodes. Back of the stomach nodes travel along the celiac nodes. This is the blood supply diagram which we need to draw. First of all, this is the lesser omentum. This is the greater omentum. So it is having the left gastric artery, which is a branch of celiac trunk. Then we have the right gastric artery, which is a branch of proper hepatic artery. We have the right epiploic artery, gastroepiploic artery, proper hepatic artery, which drain into the superior mesenteric plexus. The right two-thirds drain left into the left gastric nodes along the artery with the same name. We have the esophagus, celiac nodes, and the left one third pyloric. Left drain from pyloric part drains into the pyloric, hepatic, and left gastric nodes passes all. Then this is the lymphatic drainage of the stomach, which has the left gastric nodes, celiac nodes, hepatic nodes, and the pancreatosplenic nodes, right gastroepithelial nodes. Nerve supply. Nerve supply is important. Many of you forget to write nerve supply when blood supply is asked. The blood supply is to be connected with the nerve supply. So you need to write the sympathetic as well as parasympathetic. Parasympathetic is done by vagus nerve of all the abdomen. Sympathetic is done from the T6 to T10 of the spinal cord by the greater splanchnic nerve, celiac, and hepatic plexuses. These travel along the arteries supplying the stomach. Then we have the vasomotor, which is motor, pyloric, inhibitory, chief pathway, pain sensations of the stomach. Parasympathetic nerves. This all, if you even don't write, it's fine, but you need to write the gastric branches from the anterior surface of the fundus and the body of the stomach. Then we need to write the posterior surface, pyloric antrum, celiac plexus, stomach, HCl, pepsin secreting, inhibitory to pyloric sphincter. Now inferior of the stomach, if you write, you have to write the internal structure and this thing. This is the nerve supply of the stomach by the anterior gastric nerve, which is the hepatic branch, pyloric branch, then posterior gastric. Then the mucosa of the stomach is thrown into the folds of the gastric rugae. The rugae are flattened in the distended stomach, and there are gastric pits, which you need to mention like in a diagram of the pylorus and the fundus. We draw these gastric pits, which needs to be mentioned. Then we have the muscle coat, cardiac notch, and everything. This is the smooth muscle layers of the walls of the stomach, which is the outer longitudinal layer, inner oblique layer, middle circular layer, and the pyloric sphincter. So the functions of the stomach also you need to write for the 10 marks LAQ. It acts as a reservoir of the food, mixer of the food, peristaltic movement, soften mixes food with gastric juice, gastric glands, enzymes producing like pepsin, HCl. Then the gastric gland produce hydrochloric acid. Then corrosive action, gastric mucosa lining of the produce abundant mucus. Mucus secretion is very important for the stomach to prevent it from the corrosive action of the hydrochloric acid. Then it produces the intrinsic factor which helps in the vitamin B12, which deficiency leads to the pernicious anemia. Clinical anatomy is also to be written. Gastric pain is left felt in the epigastrium because of the stomach supplied by the segments T6 to T10 of the spinal cord, which also supply the upper part of the abdominal wall. Pain is produced either by the spasm of the muscle or by overdistension. Ulcer is attributed to the local spasm due to irritation. Peptic ulcer can occur in the sites of pepsin and hydrochloric acid, namely the stomach. Meckel's diverticulum, blood group O. O blood group, it is common, the peptic ulcer. Why? Reason we don't know. Gastric ulcer occurs typically across the lesser curvature, homologous with gastric ruminants. Mucosa not definitely. Then blood supply less abundant, nerve supply more abundant. Then we have Hari-Bari-Kari syndrome. Gastric carcinoma is to be written. Pyloric obstruction